Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of the MRCP within the last 5 years and want to help you do the same. We're not associated with any MRCP examination organizations, and the materials covered are by no means an exhaustive list of what can come up in your exam, and indeed are not intended to be used as medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is on combined T cell and B cell defects under the section of Immunology. So what are the combined T and B cell deficiencies? These are a group of inherited genetic defects resulting in failure of normal development or maturation of T and B lymphocytes. An example of this is a severe combined immunodeficiency or SCID. As far as its epidemiology is concerned, these are really a heterogeneous group of conditions. They are usually, however, inherited through an autosomal recessive or sex-linked inheritance pattern. And the inheritance of this, for instance, in France, is about 1 in 100,000. The presentation of this condition really is surrounding recurrent infections as far as MRCP is concerned. So you would be encountering a case of somebody who's normally either a child or somebody who is a young adult who's had problems with multiple recurrent infections, and particularly in the form of pneumonias, skin infections, and GI disturbances. And in case of pediatrics, which is unlikely to sort of directly be questioned in your membership exam, this could potentially be presented as a case of failure to thrive. So the signs of this is associated with poor growth, structural organ damage from repeated infections, as well as active infections at the time of presentations. The investigations that are appropriate to do would be surrounding trying to find out whether there is an active infection or not. These will include full blood count with differentials as well as blood cultures. And it's really important to know that babies with clinical features of SCID and lymphopenia of less than 1.5 as newborns should be referred urgently to the regional tertiary centers for immunology to be investigated and managed appropriately. So that's something that potentially would be important to mention as part of your communication skills, for instance, or station 5 in the case of PACES. The differential diagnosis really is secondary immunodeficiencies. And of course, the big ones that physicians deal with quite frequently are HIV or lymphoid malignancies. The management really is divided into two subgroups. One is a short-term and the other one is long-term. The short-term management is really surrounding avoiding live vaccinations, as well as prompt diagnosis and aggressive treatment of any infections in a timely manner. In order to support the physiology of these patients, if they need to be transfused by any blood products, it's really important that they are irradiated blood products. In terms of long-term management, the pillars of management really is surrounding intravenous immunoglobulins or IVIG and prophylactic antibiotics, mostly in the case of cotrimoxazole in the UK. Sometimes you could consider bone marrow transplantation if HLAs are matched. However, this is something that is extremely unlikely to be expected in depth from you when you're sitting your membership exams. So let's do some questions. Which of the following statements about severe combined immunodeficiency or SCID is correct? A is primarily a T cell immunodeficiency disorder. B is typically caused by an overproduction of antibodies. C is usually diagnosed in adulthood. D can be effectively treated with antibiotics alone. E is characterized by the absence or severe deficiency of both T cells and B cells. So the correct answer in here is option E, which is characterized by the absence or severe deficiency of both T and B cells. So recall that from our discussions earlier, this is involving both T and B cells. Therefore, option A is incorrect. This is not something related to the production of antibodies and is frequently diagnosed in childhood. And as we discussed, the management is not going to be surrounding antibiotics alone. And you need to be thinking about the immediate management versus long-term management, as we discussed earlier. Thanks for listening to this episode of Bite Size MRCP. If you like what you heard today, give us a thumbs up and hit the like and subscribe button to make sure that you don't miss out on our next episode. Let us know in the comments which topics you would like to hear in the future. See you in the next episode.